Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, the highlights. Kaduna State Government, with support from UNICEF, hold meeting to tackle vaccine hesitancy among health workers. Cross River State starts massive campaign in schools to prevent spread of infection. And owing to wide vaccination coverage, Russia waives regulation to display QR code for access to indoor recreation spaces. The Nigeria Center for Disease Control (NCDC) announced in its daily updates last night that the country recorded 159 cases. Lagos still maintains the highest figures with 119 new cases, representing 74.84% out of the cases reported. But the agency, however, said Lagos data includes cases from Wednesday. Meanwhile, the NCDC is calling all Batch B National Youth Corps members to be mindful of the risk of COVID-19 as they prepare to enter into orientation camps. Let's take a look at the latest report.
In the latest figures coming from the Nigeria Center for Disease Control, the NCDC reports 159 new COVID-19 infections from 7 states and the FCT. This is a considerable rise from 48 infections recorded a day before. Lagos stands out with 119 of these. 19 cases were reported from Akwa Ibom. Rivers had 11 cases, Ogun had 5, and Ekiti reported 2 cases. Delta and Kwara and the FCT each had 1 case. The report includes data from Lagos State for July the 14th, 2021. Plateau, Sokoto, Kano, Oyo, Ondo, and Kaduna states did not report any cases in a time under consideration. Nigeria now has a total of 169,074 confirmed cases. 10 people were discharged in the last 24 hours, raising the total number of recoveries to 164,662. There was 1 reported death, raising the fatality toll to 2,126. Currently, there are 2,286 active cases in the country, while over 2.3 million samples have been tested so far. The latest update by the Africa Center for Disease Control shows that Nigeria has successfully vaccinated more than 3.9 million eligible persons across 36 states and the FCT. In Africa, there are over 6.1 million confirmed cases and more than 155,000 deaths on the continent. Globally, more than 188 million COVID-19 cases have been confirmed, while deaths have surpassed 4 million.
Hesitancy of COVID-19 vaccine among some health workers in Kaduna State has been identified as a major challenge to the vaccination program, if not properly addressed by all stakeholders. This observation was made by the United Nations Education Children's Fund and the Kaduna State Ministry of Health at a 2-day consultative meeting with Health Workers Association on COVID-19 vaccine acceptance and uptake.
This is a meeting organized by the Kaduna State Government and UNICEF to address vaccine hesitancy in the commerce. Ironically, participants are all health personnel, some of whom have buckled under the weight of false information about the vaccines. Vaccine hesitancy in the entire state is being put down partly to this apprehension among health workers.
So when it comes to vaccine hesitancy from the health workers, we really needed to take this seriously, bring all of us to the table as stakeholders to discuss and get to the root of the reasons why we're having this challenge, to be able to address it collectively and move forward.
Besides, there's a crucial reason hesitancy is not an option among health workers.
We need you to be hale and hearty, to be able to support as you move forward in the fight against COVID-19. And this is especially important at this particular point in time with the Delta variant of the COVID.
One of the strongest reasons to trust the vaccine is put forth by the incident manager of the COVID-19 task force.
If the vaccine had any issue at all, I don't think any country would prioritize the health workers as the first people to accept this vaccine.
One of the takeaways from this meeting is that vaccine hesitancy is an important public health problem, and it puts public health at risk, especially in the wake of the Delta variant, which has spread to over 100 countries.
In Lagos, a new directive from the University of Lagos has asked students to vacate the halls of residence latest today. The deadline was extended when authorities noticed that it would be too much of an inconvenience for the students to empty the halls at such short notice. Students were asked to leave the hostels when the institution's medical center reported the discovery of several cases of COVID-19. Our correspondent Mary Alale Yusuf reports.
University of Lagos Akoka campus, after students were told to vacate the hostels following the discovery of many cases of COVID-19 among them. Tempers flare. Confusion reigns as students scamper to leave the campus before the noon deadline. They feel the situation could be handled with more consideration for their welfare.
I feel like the whole thing is just very impromptu. They didn't tell us early, number one. It's just yesterday they told us that we have to start moving till 12 today. And I feel like they should have even told us to go home from the moment they found the first case. It's now yesterday that they were just doing their meeting and chasing everybody home. It's so frustrating because now people have to be paying like 11,000 naira to go home.
Most of my classmates stay in Nasarawa, Kano. How do they want them to live at least under 16 hours?
The hostels are really crowded, so I feel closing down the school is the best decision. And online schooling. But the problem I have, the fear I have is that they are not going to use a good site for our exams because last lockdown we had issues. Most people were locked out during their tests and exams and they could not take the exam again.
The Dean of Students' Affairs never imagined it would come to this.
Over the next 3 weeks, we started getting an increased number of students testing positive for COVID. By the 12th of July, we had about 28 students confirmed. We also had staff that also come down with COVID.
He claims that students flouted COVID-19 safety protocols, even though every precaution was taken.
So students were not actually obeying the COVID protocols. Literally under compulsion. Once they got out of the hostel, they removed the mask. We see them walking all over the campus without masks, without social distancing. We insisted that there should be no squatting in the hostels. But they did everything they could to smuggle themselves into the hostels.
The school authorities have extended the deadline for departure by 24 hours to make things easier for the students.
For now, closure of the hostels is for an indefinite period of time. But authorities hope that in September, when a new batch of vaccines is likely to arrive, then students can be called back, vaccinated, and start physical learning. Until then, it's distance learning for them. Mary Alale Yusuf, Channels Television News.
Meanwhile, the Cross River State Government is restating its commitment to ensure that students across the 18 local government areas of the state are free from the COVID-19 infection, despite the outbreak of a more deadly strain. Speaking at the state's Ministry of Education complex in Calabar, the state's Commissioner for Quality Education explains that since the outbreak of the pandemic in early 2020, no casualty has been recorded from students across the state.
We've been working with the Ministry of Health for the children to remain protected. And we've been teaching, including the teaching we're teaching right now across the board. We're also teaching them social distancing, constant washing of their hands, for the teachers to pay attention to personal hygiene and cleanliness and all that, ventilation in the schools and all that. We've been teaching that and we've been encouraging teachers and students and pupils across the school to adhere to this. But we pray that so far there has been no incidents. There has been no incidents, and this is about the third term since COVID. So far we've not had any incidents of death or incidents of infection of any students or pupils or teachers.
Meanwhile, the National Primary Healthcare Development Agency has announced the expectation of more COVID-19 vaccines into the country. They include the Oxford, AstraZeneca, Moderna, Pfizer, BioNTech, and Johnson & Johnson vaccine shipments in the coming months. According to the breakdown, the AstraZeneca is expected early July and August, was donated by COVAX. 4 million Moderna vaccines are expected in August by COVAX as well. 3.6 million Pfizer-BioNTech donated by COVAX as well, and 29 million Johnson & Johnson doses expected by September, donated by the African Union. Dr. Gemiu Janiu, a public health physician, joins us now for more on the situation of COVID-19 in the country. Thank you for joining us on the program.
Thank you very much.
First, I'd like to get your thoughts. I mean, the University of Lagos and the measures they've taken, some have argued that perhaps when they realized they had a first case of COVID-19, the precautions and the measures should have been taken initially, not until, having multiple cases. What's your take on that scenario?
Okay, thank you very much. I think based on my experience and my thinking in line with the management, I think they acted well, thinking that it can be managed. Before now, the protocol, as if that if a school or an institution should have a kind of organization and organize it in such a way that they can also, manage a certain number of cases, maybe having an isolation area, and trying to manage to moderate cases. In the event that they have a severe cases, they will just link it up with the Lagos state government. I think they try to salvage the situation, but as the cases continue to increase, they have no choice than to, because I think they actually took a decisive action, because if the whole thing gets overwhelming, the school may not be able to handle it, and nobody wants to risk his or our students, dying from this from the virus. So I think the best approach is what they have just done, that everybody should go home. Because this virus thrives where there are clusters, and the nature of our hostels, you can see like 10 or 15 people in a room. I think the best way is what they have done to reduce likely transmission of more of the virus among the students. Sorry, they may feel the pain. I think the institution actually took a well-decisive action just to save them from getting infected with the virus.
Dr. Gani, let's talk about what NAFDAC has done, adding more vaccines to the list of those approved for emergency use. Do we really need more brands added to our list of COVID-19 vaccines?
Yes, we did it. Nigeria is not in isolation. Even other countries, for us to be able to achieve a coverage about 60–70%, you have to need another brand, because generally there are global shortage of AstraZeneca and another brand. So it's a way of a kind of making sure that we achieve more coverage, more people get vaccinated. Nigeria is not an exception to that. Many other countries, I don't want to mention them, also have different brands, just to see that everybody gets immunized, get vaccinated with the COVID-19. So I think what Nigeria has done is a welcome development, and we are really happy about it. But initially, I was a bit worried with the Sputnik V, because the belief was that WHO has not, approved it for emergency use. Likewise, the European Medicine Agency. But after, going through some other countries' experience, I realized that it is currently being used in up to about 70 countries. And, the Sputnik in particular belong to the same class of AstraZeneca and Johnson & Johnson. But the advantage it had is that it is not associated with the clotting disorder being witnessed with Johnson & Johnson and AstraZeneca. And I think this is the right time for us to have a local content. Every country are now adapting a system that they feel can work for their own citizens. And I think what Nigeria is doing is actually commendable in that respect. Thank you.
We appreciate your time, Dr. Jamiu Ganu, a public health physician. Thank you so much for joining us on the program.
Thank you very much.
The Ogun State government has said that there is no confirmed case of the Delta variant of COVID-19 within the length and breadth of its domain. This was disclosed by the Commissioner for Health, Dr. Tomi Koka, in Abeokuta, while reacting to the news in some quarters where her earlier call for strict adherence to public health guidelines and report of 15 new cases in isolation center was mistaken for the new strain of the dreaded disease. Dr. Koke said although some states have recorded the new variant, but it was not the case in Ogun State. She said that the need to adhere to all the non-pharmaceutical guidelines of wearing the face mask properly, washing hands, frequent use of hand sanitizer, maintaining physical distance, and refraining from unnecessary social gatherings, given the high transmission rate, was important at this period. The Number State Commissioner for Health, Dr. Vincent Opala, has reiterated the commitment of the state government towards enhanced surveillance to ensure the third wave of the coronavirus infection is prevented from spreading in the state. Speaking in the state capital, Dr. Opala discloses that 41,334 residents have been vaccinated, but it is worrisome that a lot of people in the state have let down their guards on the COVID-19 protocols.
We've gained increased capacity response to respect to surveillance. We've gained increased capacity with respect to testing and treating. And we've also gained increased capacity with respect to the preventive measures. Remember, in this state, we developed the chain of survival. And that chain of survival, we keep on re-emphasizing to the residents how important it is to follow that chain of survival, because if we do, the decreased mortality that we noticed in the states in the first and second wave will still be the same in the third wave. So that is our prayer. We are happy that with respect to vaccination, we didn't experience a lot of wastages in the state. Our stock of supplies were finished before the expiration date of the vaccine.
Outside the shores of Nigeria, record rainfall has caused rivers to burst their banks, devastating the region. At least 120 people have died, and hundreds more in Western Europe are unaccounted for after some of the worst flooding in decades. In Germany, where the death toll now stands at over 100, Chancellor Angela Merkel called for a determined battle against climate change. While that is before them, the EU is getting ready to distribute billions of euros to member countries in the weeks ahead to help their economies get back on track after the coronavirus pandemic. Deutsche Welle correspondent Chelsea Delany brings us up to speed on the latest. Hi, Chelsea. Now, many EU countries have been reopening their economies amid low infection numbers. Why are these stimulus plans happening now?
Well, that's a good question. Why spend all this money now when the economy is recovering instead of a year ago? Part of the reason is that the EU moves very, very slowly. It actually approved this stimulus package last summer, so about a year ago, after some very long and difficult negotiations. It was really seen as a groundbreaking decision because it involves the EU borrowing jointly for really the first time ever and a large scale, which for a long time was a very taboo subject here in Europe. So all of this took time to work out. And in the meantime, European governments have been supporting their economies as well through things like short-time work programs or by giving loans to businesses. But many countries here in Europe, particularly the weaker, the poorer ones, have certainly not had the resources of, say, Germany or the US. And that means we've seen a very unequal economic impact here in Europe from the pandemic. So this recovery plan is intended to level the playing field, and the countries that have been hit hardest by the pandemic, like Spain or Italy or Greece, will be the biggest recipients of the funds.
With the EU planning to spend up to 800 billion euros on the recovery plan, what will that money be used for?
Well, the EU wants to use this money to prepare countries here for the big economic shifts of the years, the decades ahead. It's named this the Next Generation EU Fund, and that name tells us really a lot. Most of the money, almost 40% of it actually, is focused on climate efforts. So things like making buildings more efficient, green energy projects, electric vehicles, digitalization is also a huge priority here, with countries like Italy planning to focus on increasing 5G networks, on improving the access to broadband. But there are also a lot of other interesting projects. For example, in Spain, they plan to spend about €1 billion on boosting sports and culture. So a large part of this is giving EU countries the money they need to get ready for the energy transition, for the increasing digitalization of the economy. But there's also a social aspect to this as well.
Also, how big of an economic boost will this be for EU countries, especially at this point?
Well, for countries like Italy and Spain, it will be significant. Many of these projects are really crucial for readying countries for the massive changes that are happening in the global economy. But overall, economists say that the EU is just not spending enough on these recovery efforts. The EU spending in response to the pandemic equals about 12% of its GDP. That's about half of what the United States has spent, and they worry that the EU's timidness here, their reluctance to really splash out with bigger stimulus efforts, mean that it will take much longer for Europe, especially the weaker countries, to fully recover from the pandemic blow.
Also, Delani, DW correspondent from Berlin, thanks for that update. And now Moscow residents will no longer have to present a QR code demonstrating they have been vaccinated against COVID-19 or have immunity in order to sit inside cafes, restaurants and bars from July 19. Now, Russia, which reported a record daily rise in coronavirus-related deaths on Friday, is in the grip of a surge in cases that authorities have blamed on the more contagious Delta variant and the slow rate of vaccinations. Here's more on the global update.
Moscow residents will no longer have to present a QR code demonstrating they've been vaccinated against COVID-19 or have immunity in order to sit inside restaurants and bars from Monday. Since June the 28th, residents have had to present a QR code that proves they've had a vaccine, a negative test or immunity to be able to sit inside, but outdoor terraces remained open to all. Authorities say the rate of vaccination had sped up in the Russian capital and that the restriction could therefore be relaxed.
Late yesterday, when 2 additional cases were
over in Australia, officials have urged people to obey lockdown measures that cover around 40% of the country's population as an outbreak of the highly contagious COVID-19 Delta variant picked up pace today. Victoria reported 6 new cases over the past 24 hours, the first day of their 5-day snap lockdown, bringing the total cases in the state under the current outbreak to 24. In neighbouring New South Wales, officials recorded 97 new locally acquired cases. Israel is considering stricter health restrictions to combat an increase in infections as the Delta variant spreads. The plans will need to be approved by the parliament. Israel's Prime Minister's office says new plans would allow only vaccinated individuals or those who have recovered from the virus to take part in indoor events of more than 100 people. Masks will have to be worn except while eating or drinking. Over in Asia, South Korea's Prime Minister says the country may have to impose stricter restrictions on private gatherings as health authorities reported 1,536 new cases of the virus. The more contagious Delta variant has led to a 4th wave of infections among the unvaccinated.
Remember that when you wear a mask, you're doing your part to protect the society and the world. Thank you for masking. Visit our website. It's channelstv.com. It has more updates, a better understanding of the pandemic. You find other stories, breaking news. It's all at your fingertips. That's the program this evening. Thank you for watching. I'm Millicent Walker. Stay safe.